IOTTT Saturday Night Chat. So the topic for today is going to be we are going to talk about the entry-level competence of the new therapist. How competent and prepared are our entry-level practitioners is the topic that we want to deliberate on. So if you all can get this discussion started by briefly introducing yourself, and then just I want to open up this conversation by reflect on your own entry level days. Like what I define by entry level is basically soon after you graduate with your first occupational therapy degree, the bachelor's degree, BOT, and then you step it into the practice, right? How prepared you felt. That's the first thing. Like just reflect on your own entry level journey, and then comment a little bit about were you confident? Did you feel so prepared to assume the responsibilities, or there was a bit of learning curve once you entered the practice? So let's kind of first talk about it, and then we'll also talk about how the contemporary entry level practitioners look like. All right, so yeah, lead us through the discussion. So given that we are only few people here, I will take the liberty to call out names here, and then you can go. So Dr. Sedaraman. You're muted.
Thanks, Karthik. I was expecting a little bit of academic people in so that they will take us to the next level, which will be the purpose of the meeting would have been.
True, very true.
thing. But as you said, I will start with my own experience. Kind of, I don't have that liberty of having, but maybe it is a purposeful thing, kind of thing. Immediately after my internship, I opted to go for my post graduation, basically because of this, how confident I am. That was the bigger question I had. So I was never had that confidence of handling a patient individually by then when I finished my internship. That was the main reason I opted for my post graduation, which I documented during my introductory session at my PG, where people have looked at me. No, no, PG is for academics. Why you are come here, kind of a thing. So that is how it is. But yes, definitely my PG has given me that confidence. When I came out, even though after right from my third semester, that is start of the second year, we had clinical postings right from 9 to 1. Every morning we had that clinical postings based on the papers we had in different papers per se. So each semester we had a posting at different thing. For example, the third semester and fourth semester, it's more of psychiatry. From fifth, it started with pediatrics, neurology, orthopedics, and everywhere kind of a thing. Even then, after that, 6 months of complete internship at all six different domains. Somehow that confidence was lacking. That is what my personal experience. So PG was the place. Nirtar was the place where I did my PG, and that has given me the courage or confidence to handle the patients per se, kind of a thing.
Got it.
Coming to the kind of clinical as today the students are getting in today, as of now, I see some of the students who get posted in NAMANS for their internship, kind of a thing.
Mm-hmm.
I'm not feeling that, even though their theoretical understanding is far better, when it comes into clinics, um, there are certain places where I've gone for as an examiner to some places also. So when it comes to when it is a theoretical question to them as a part of Viva, their answers were in a different level. When it comes to questioning their clinical skills of assessing or goal planning, there is a vast difference between the theoretical understanding and the clinical thing. So I feel there is much greater scope to push the clinical teaching and then getting them more confident when they go out, kind of thing. That is what my initial understanding about to get into this topic per se, kind of a thing. Maybe Jyoti and Ashwini can add to it.
Sure, sure. All right, so I'm going to call upon QWERTY next. QWERTY, please introduce yourself and share your thoughts. QWERTY, can you hear us? Hello? Please unmute yourself if you're talking. You're muted. Poor connection. Okay, so go ahead and post your views um, on the chat so that we know what are your thoughts and your experiences are. Okay. Yeah. Again, I just want to highlight this, that this discussion would become more and more rich and useful as we contribute our views. That's a purpose. So I'm going to call upon Jyoti Kumar next. Jyoti, go ahead.
Thanks, Karthik. I know, as you can see, I'm attending this meeting from the car. It's not usually I will dedicate some time to get into, but I'm just coming back after organizing a yoga session for the Indian Embassy. And you rightly reminded about the meeting started, so I didn't want to waste time. So I just joined
Thank
in.
you.
And it's also like good, like, I won't have any distraction while in the car. So just excuse me for the background or everything.
Sure.
And as an entry level clinician, like, when I was graduate, I graduated from Meenakshi College of Occupational Therapy in Chennai, India. And as an entry level new graduate, I was like looking at like what would be my career looks like. No, even at the final year and the placement, we started looking, okay, what are the career opportunities? Masters, or shall we go ahead with the entry level career opportunities? When I'm looking at the path, and for me, rather than going for higher studies, just to explore the career opportunity was my personal goal, due to various circumstances. And at that time, I wanted to see how I can get my foot on the career opportunities, because getting a career at the right institution was even a challenge. So when I was doing my internship, I started exploring the options of getting career opportunities. I was lucky. I was the first person in my batch to get an opportunity on my third month of internship. So and that maybe, fortunately or unfortunately, that really put a barrier for me pursuing higher studies. So even during internship I was working part-time. The morning sessions were like for internship, and the evening I was working. That gave me a little bit of responsibility, how you can be as a clinician, and that also enhanced me how see, only when you put, like, when you face a real life challenge of getting a career options, you would know like what is the how world is, how wide, what are the other skills you need to improve. And I was looking at how I can excel in this field of occupational therapy, and learning was just a theory, and then there's lots to learn. It was an eye opener for me. My first career opportunity was I was working in an autism research center, and I was scheduled with the pediatric. So I had a vision to explore more in the fields of occupational therapy. Then I chose to get rotational experience, or like multi-level experience, and I chose internship placement with Christian Medical College in Vellore in India. And what they would provide is, to meet the higher standards like developed countries, they will give a rotational option. So anyone who is getting a placement there will be rotating. Like for the first month they will be in pediatric, and then mental health, and child and adolescent mental health, and then it will be moving on to community rehabilitation, and then into acute wards, and like the placement will go on for the 12 months. and to be like, we are still having the journey. Lakshman and I went for the interview together, and so I can still remember after being like getting on the panel list, like Lakshman and I were traveling in the same bus in the seat next to each other, and as Lakshman shared, like he had the vision of doing the masters at that time, so he was talking about Nirta, and we can still remember that. And eventually, Lakshman went through Nirta, and I went to Christian Medical College to complete my full rotational internship. And it's a paid internship, so it was a career, but still you were like learning. So, and that opened many doors for me, many skills I learned. I think I can't describe enough what are the skills I attained in those 12 months. And I did have an opportunity for literature review, and I had an opportunity to present cases. I had an opportunity to go for rounds with consultant, and even like involved in sessions like hemophilia clinic, like what is role in hemophilia, or what is role in child developmental center. So those are the opportunities that I got at that level, and I that really boosted my passion towards how I can explore in occupational therapy. And at the same time, I was looking for opportunities across the globe. And at the same time, I got registered for HPC and with UK, and also I got registration with Irish Health Sector. And I went back to my same, like I have a like dude. I felt that I though my initial employer trusted me during my internship, so I felt like I need to give back to the employer. So I went back to the same Autism Research Institute, and I gave 2 years of my role where I developed the department. At that time, it was an primary occupational therapy department, where I developed that into a integrated allied healthcare department. So which included occupational therapy, physiotherapy, and speech and language therapy, and special education, and in also like a few educational and vocational settings. And then I got opportunities abroad. I settled in, worked briefly in UK, and then I have settled now in Ireland, and I have worked across the career. And I would like to take this opportunity. I'm going to take another role. I'm currently as a network manager, managing all allied health for the government of Ireland, and I will be taking a role as an OT manager in the very next month. So that's how my journey is. Probably you got my full journey in occupational therapy, and I'm privileged to be part of Indian think tank and sharing my knowledge with other few members here, and putting my effort into some papers. I know I don't get into these meetings quite a lot because due to my I think part of my role went beyond OT and managing a whole department, but I'm trying to get back to the roots where I'm from. Thank you. You muted, Karthik.
Thank you for your experience, sharing your experience with us, and kind of you as also like gave a quick snapshot of your career's journey here. Thank you so much. So Ashwini and Soundarya, welcome to the meeting. So the question we are discussing is basically, this is the very first question that we are discussing today, and what I asked is for the participants to reflect on their entry-level days, like it means once you come out of the college with your bachelor's degree and then entering practice, how confident were you? Did you feel prepared back then? That's the first part. And the second thing is, what is your view in terms of the current day entry-level practitioners? How competent and prepared they look to you? That's the question we are at. Ashwini, your turn. Welcome.
Thanks, Karthik. I am going to stay off camera today because it's just in the middle of the day and I'm not very well, so I'll just talk. That's a really nice question. It reminds me how old I am. But in terms of what actually led me to start exploring what can I do as an OT after graduation? It was actually my first role. My very first role, you're literally thrown into the sea and you have to figure out tools and resources. And then that's what I had to do. I had a couple of options in a general hospital in Tralee and one of the in the south of Ireland as well in terms of a regional autism service. So I was recruited. I finally took that role. At the time, I also had the option of working in Father Muller's in Mangalore and a couple of other options in the States because I had got a scholarship in Thomas Jefferson and another state university there. But life led me to Ireland and I took up a role in the autism services. But there was nobody there to actually show me the ropes because the previous OT had just left. So I was literally the youngest kid on the block joining a multidisciplinary team with a clinical psychologist heading the team. And when you learn about pediatrics in your entry-level course, which was for me, it was in KMCH Coimbatore. What I vividly remember was Madam Anjali Joshi coming for a workshop, and I remember that workshop vividly. But apart from that, the kind of knowledge that we have right now in sensory integration, which requires a broader understanding of neuroscience and a more detailed, layered study, including clinical practicum of sensory integration per se, we did not have that then. So going into a setting, an autism setting, was very daunting because what actually is my clinical base other than the little immersion or the kind of scattered understanding we had across lots of different pediatric conditions, not necessarily neurodiversity. So for me, I had to learn from other people because there were other services in other parts of the country. So I was actively encouraged by my manager to seek out support systems and find out what best practice was. And at the time in UCC, which is University College Cork, there was also a really nice module in terms of evidence-based practice. And they were offering that to clinicians. And they were also encouraging active links between the university and people in clinical practices. So that led me to understand more about evidence-based practice and, okay, how can I actually use research to support what I'm doing? And that led me into a little study on the ALERT program, which was one of the tools, one of the approaches that we would have used in that setting. So I think it was without having those networks in the research department of the university and without having other clinicians to network with, it would have been very hard to find out, okay, what needs to be included in clinical pathways? How do I create a clinical pathway? How do I screen? How do I process the referral? All the different logistics when you have a huge list of people waiting to access a service. So I think in terms of administration as well, I felt there was a gap in terms of using administrative skills. Documentation. How do we create a referral form? What needs to be on it? That as well, I felt there was a little gap, but I learned. But what was, having said this, what did come really handy and also something that I felt I'm very thankful for in terms of my education in KMCH was, the focus that was there on physical assessment and assessment in terms of musculoskeletal conditions, assessment in terms of neurological conditions. All those skills came really handy because I was still able to look at things like postural tone. I was able to look at dynamic postural responses. And all of that is so important. And right now it's so important in research in neurodiversity as well. So that was something I think which was missing there because there was a little gap in terms of how, in terms of the layering of these clinical subjects. I don't think, like later on when I took students on over there as a practice educator, I saw that students may not have had the same understanding of how there might be an overlap of physical conditions in neurodiversity as well. So we had that, I think, because we were in a hospital-based program in India, we had that advantage. So just to make the story a little shorter, I think we had to pull out supports from in all possible ways. Other people, other networks, research-based, and also self-directed learning. And that module that I did in UCC then led me on to a modular pathway, and then finally actually doing a research program there in terms of autism in mainstream schools for Irish adolescents, a qualitative study. So it just happened, I think, little by little. When you understand what your gaps in knowledge are and you have the right people, you find a way to fill those gaps.
Excellent, excellent. Real quickly, if you could just take another minute to share what are your views in terms of contemporary entry level. I mean, of course, you may not be in India, but we are talking about the context of India here. But if you have any thoughts about your views in terms of the contemporary entry level practitioners.
I can't speak for India, but or Indian schools, but in terms of the students that come for placements, and right now I'm in Warsaw, so again, I'm removed from the Irish context. A couple of years ago when I was working in Ireland and there were students, I felt that there was a lot of critical thinking. I felt that students were asking questions irrespective of, where they were, who they were around, and what setting, or whether it was a meeting if I had a student in a specialist autism school, and we had a multidisciplinary meeting which included the school principal, the other clinicians working in the school, and even teaching assistants, and there was a student who was joining me for that meeting. It did not matter to her whether that was her first placement and she was asking something that was obvious. That confidence was there to ask. So I think that curiosity and assertiveness, and also in terms of critical thinking, also connecting knowledge from different placements and asking what is not obvious, that was also something that I noticed. And I feel that from my own experience as a student in India, I feel that maybe there was a sense of maybe there was a hierarchy, I would say, of sorts between teachers and students, and that might have come in the way in terms of Viva and other aspects of education where direct interaction was involved. And I think somewhere that's there in the psyche, that that is there, and I can't explain it further. I think you understand.
Yeah, I got it.
So I think that teacher-student relationship and clinical educator student relationship in the Irish context, I felt, has been very different, and it has facilitated learning for the student.
Got it. All right, Jyoti, I see your hand. Do you have a quick comment?
Karthik, I think I missed to answer the second question. I was too much taken away by the first question.
That's fine.
If there is a minute, I can share my perspective on the contemporary. I have a privilege of doing some workshops and webinars for to universities in India after moving abroad and working here. And now in my current role as a network manager, I'm also sitting on the panel for interviews, and I have some privilege of interviewing people like multinational, but I would stick to the context of this question and being how I see the graduates from India are focusing after their graduation and how they are performing and to secure career opportunities. In that context, in my view, I see that almost, if I can give an approx percentage, almost 70% of graduates are more focused on pediatric intervention or pediatric scope. Their scope were all around, and then either 30 or less than 30. I think anyone from I think Lakshman or anybody from IOTA can answer this, how there is an wider scope. And there's only like 30 for the rest of disciplines. When you think that fields in occupational therapy, like it doesn't stop with pediatrics. For example, like in the department that I'm managing now, like pediatric is only a portion of what an occupational therapy can offer. There is a wide specialties, and like though they are learning in their curriculum like 4 years in multi-level of the scope of occupational therapy, and due to the trend, or I don't know, like their focus is mainly of the career opportunities and also to how they can develop their clinics, which is more in pediatrics demand. So that's where the focus is. But occupational doesn't stop with that. So and I would say like they should have like when you say contemporary, like they should have the scope, or even at the entry level they should be trying their they should be exploring all the fields of occupational therapy, so that, and likewise they can choose. I started as a pediatric occupational therapist, and then I moved on to adults, and then I moved on further. So that should be the way, rather than to conclude in one discipline. It's better to experience and then choose what is your specialty, where you need to go. So that will help. This is my perspective. How an entry level graduates from India are at the moment, and at this stage with the level of experience, I can say like maybe this is as a suggestion. They can even like keep an eye open to explore, and then choose where they need to specialize.
Thank you.
Thanks.
Thank you, Jyoti. I think, I'm glad to see more participants have joined now. Welcome, everyone. Welcome, Mr. Ramalingam, Mr. Muralikrishnan, and Parul. So let's go ahead. And again, I really like, I mean, all these are fantastic information. I already like pick out certain themes here, but let's hear from the rest of the people. Let's kind of like, be brief so that like we get a chance to hear from everyone within the limited amount of time we have. So Soundarya, your turn. So the question is basically just reflect on how prepared you felt when you came into practice out of college.
I am the graduating batch of 2018. So I think this is my recent experience. But I also had the opportunity to work in the same college hospital where I did my UG. So things were very graded for me. I did get to explore all areas, and I did have the freedom to try out new things where if I wanted to participate in research again if I wanted to have discussions. So the initial few years of my life was I'm still in love with OT because of that. And I might be biased if I answer something else. So that is there. And I was honestly hoping to join today's session to get to know how things are right now, because I have joined a college as academician a few months ago. And
welcome to academia.
Thank you. We'll see.
Good. So I think that's great that you joined, because we would also like to hear from academicians' perspective in terms of what can be done. Thank you. And like, given that now you are in academia, probably you might have come across some of the contemporary students. So again, Soundarya, if you could just kind of take another minute to talk about how what is your perception in terms of how prepared they are, like when they walk out of the college, are they ready to take on a caseload and then like kind of go with it? Are they that prepared or not?
I feel that they have a lot more confidence than I had when I finished my youth. But I also somewhere do fear that might be a little misplaced. I have seen how a lot of education has become more of a checklist. And even though evidence-based, there is a lot more evidence coming up in OT. The idea of doing an evidence-based treatment is still in process. So I don't know if I'm in a position to say how misplaced it is. given that I've been an academician for a few months only.
Got it.
But I do admire their confidence, however right or wrong.
Got it. Got it. That's glad to know that they feel confident in facing the practice world. All right. Thank you so much for sharing the views. Godantan sir, if you would like to go next. So yeah, the question we are discussing is how confident you felt when you graduated out of your college with your first OT degree, BOT, and then also what are your views in terms of the contemporary Indian entry-level graduates who are entering practice?
Thank you, Karthik, for organizing the group. Actually, so apologies for joining late. I didn't get the link. So, yeah. So when I finished the college, so we had the placement, clinical placement. It's a comprehensive. So we had the placement in Balavigar, the pediatric, and we had the neuro in the Nemans and the orthopedic in Karigari, and also in the one in the Madhya Kailash area, the hospital, VHS, and we had the orthopedics there, and we had the IMH, and so the mental health, and we had the one in Vellore, the pediatric center in Satvachari. So we had the clinical placement all like a month in every places. And so we were confident, we were allocated a caseload. And so as Jyoti said, it was kind of a broad. So we were having experience coming out of the college in all the areas. So I was in India in the pediatric initially starting, and I was there in India for 5.5 years. And then I did the community rehab, a part of the project. And then, so you move on to the specialty. So kind of, I worked in the older person nearly 20 years. And so I don't know much about the pediatric new developments or the mental health. So I'm kind of, I could say, my focus is very narrowed into a older person and the adult rehab. Again, coming out of college, I more theoretically was strong. I was in the college and is fresh in mind. As life moves on, there's a lot of experience, a lot of things comes on. So it's a hands-on. So you just move away from the theoretical side of things unless yourself in the academic, it's all hands-on. If you give somebody to me, I can just in a minute, I can figure out without, just that's the blessing being in the field. So like touching on what Jyoti mentioned, so I'm kind of, your career kind of dictated by the opportunities. So there are a lot of opportunity and the reward, basically it's rewarded. If you're setting up a clinic for pediatric, it's well established pathway. For the adult and the older person, there are plenty of opportunities, but there is no awareness among the general population. And that's main aim at the moment. I'm progressing. In the last week and a half, I figured out loads of things I wanted to do. So I have a membership site. Like I only had a website for the business. Now I'm in the private practice, and now I have a membership site. I can create communities. I can create groups. So I can actually mail shot as you're doing for the group. So there is a thing I was imagining. So I have a hands-on all the technologies. Now that's going to help me. So I'm like to the medium to the long future, I'm trying to stick to the adult and the older person. That's my kind of a strength. So that's what I would be kind of hoping to improve. And my is one of the, I think it's a Soundria side. I have a passion for OT, so I can't just let it down because it lifted me up when I was at the bottom. So now I can't leave it, like I can't practically do it. But even if I move away from the OT field, I still give him back time. So I have a loads of so I couldn't actually, whatever I figured out in the last week and a half. And that's what I was that I got them. I have the kind of a tools. So I feel I'm more confident now as a business, but I'm confident, obviously, 25 years in the OT. Theoretically, I just need to do a course or things just to articulate different theories and models, but it doesn't say mean, it has to, you have to have every portion. But I attended a conference, the RCOT, so kind of the middle age, you have to do a course to refresh and to be competent in the contemporary field. And that's what I'm doing. I did a day or two courses. I didn't have an opportunity to do a kind of a degree or a master's because it's so busy up to like a 20 years and always demanding. As Jyoti said, it's demanding and it's a lot of opportunities and a lot of kind of the awareness you have to create. There's so much we don't know. We
Got it.
just need to work on.
Got it. Got it. Thank you. I mean, thank you for again sharing your experience and insights. Again, we are all here, I think, because of the passion we have for the field. So thank you so much. So Murli, it's your turn. Welcome. Just again, we are talking about reflecting on our entry-level days, how confident and prepared we felt, and then also your views. Again, you have a big, busy practice. Probably you might have heard some entry-level students for internship and so on. So I really want the two part of the question. One is your experience as an entry-level OT back then, and then what are your views in terms of the current students or current graduates? You're muted. Like you're not muted, but we couldn't hear you. Your audio is not coming through, I guess.
Can you hear me now?
Yes. Yes.
Yeah. The headphone is not working, I think.
Okay.
So I have to echo something like what Saundarya mentioned, like the confidence level. When we came out, or when I came out, I also had that confidence level a little extra on myself because there were a few things which I could do. But that was only a superficial confidence, I would say, because theoretically we were good. All the knowledges were there. But practically we had nothing. Literally, I was telling a few days also to somebody that I had one autism, one cerebral palsy, one hemiplegia, and one paraplegia. The whole of my 5.5 year career of my UG when I was studied. That's the experience. Since I happened to treat all of them, I had that little confidence, but I wouldn't say that to everybody else. But when I went to PG, it's a totally different story. I happen to handle all the cases, whatever is there under the book of neurology. All the cases were seen. But again, that's over a period of time we learn and we grow. That's how it goes. I would say even now, even though the differences between the teachers is vast when we were as a student and now the people are as teachers, their knowledge level and their teaching styles and capacity in that, I definitely appreciate the present teachers for the knowledge they bring in, the research aspects they bring in. But again, I would still say the student output, when the students are passing out from UG, I would say they are just like what I was 25 years back. I would not give them credit. There are very few students who are exceptionally good, but the majority of them are lacking very basic knowledge because as a clinical practitioner, when I interview somebody, I would say they don't even have the basic knowledge. So they go to clinics, they learn from them. Those who go to clinic to learn, they do learn. But those who stay in the college, even though they have experiences, they don't have the basic knowledge of handling the children or handling the clients for that matter. Mostly they handle the pediatrics, but the other areas they are not well versed of. Even for that matter, the teachers, they are good at one area, they specialize in that area and treat. But I would say the confidence is definitely yes, because of the language, because of the culture, experiences they face and the situations they face. They are more confident than what we were in our age. But subject wise, I would say our generation was better when we passed out, is what I would say.
Thank you. Thank you for sharing your perspective. Again, hearing from all of you, and I don't know, because of network or something, some of the people kind of dropped off. Let's hope they join again. But I could really see one of the stark theme that kind of emerged from hearing from all of you is like the distinction between knowledge and competence, right? So it looks like, definitely our entry-level practitioners, even back then, as well as, continue to be like kind of very good in terms of knowledge. So, when Lakshmanan talked about, like, they are very good in answering questions theoretically on a viva, but then kind of like, implementing that knowledge in practice. So that's where the word competence kicks in, like, applying that knowledge into resolve something, treat a patient or complete an assessment, clinical reasoning, applying the knowledge to clinical reason, all those things, right? So it looks like, there is a little bit of knowledge versus competence issue going on there. And also, I heard the other theme that I could really see is, like, for several of us, I think we got thrown out into practice, or like, of course, Lakshmanan chose to get into the PG world right away, but several of us had that opportunity right away. Maybe the emerging need back then when we all graduated was there, and then, like, we got an opportunity. So then obviously, when the rubber hits the road, it needs to run. So we all kind of like learned and gained the skills. But the question again, the next question I have to facilitate this discussion is, basically, if an entry level person from India, like a person is graduating from one of the colleges in India. Of course, we all just discussed that, they are now a little bit more confident than a couple of decades ago, for sure. Again, there is more visibility now. There is a lot of things that they can learn through technology, YouTube platforms, and also there is a lot of learning opportunities available now, even for a self-motivated learner. And again, back then and now, and it's going to be, there will always be exceptions, right? There are always exceptional students, self-driven students. They are going to do what it takes to learn and try to be competent. But again, just kind of let me put it this way to guide this question. How prepared are our current graduates in terms of explaining what OT is to a layman or to a stakeholder? Any thoughts? Anyone can go. If you have a thought, just kind of like unmute yourself and go. Again, if you have that, I'd be glad to hear from people in India, because again, we are trying to contextualize this discussion in India. So any of you from India, if you want to go, like, do you really think that they have the philosophical understanding and grasp and the skill set to explain what OT is to a stakeholder? Yes, Soundarya, please go.
I'm not sure about it in the traditional sense, but I have heard a few explanations that are quite creative. And I would just like to share that. Like, someone called OT the medical jugaad. And that was, I can agree with that.
Sure.
So, and there are people who try to explain it to me using anime characters, which I did not their version of it. So I don't know how officially they are trying to explain it to people, but at least using media and using these, at least the jugaad term is something that will stay with me for a long time.
Sure. Yeah, thank you for sharing that. Again, nowadays they have more tools to express their views and also to learn, and they have a lot of models, right? In terms of, they can just go on YouTube and then like see and search about how one can explain OT to a stakeholder who's not an OT or a general public, and then really say, like, pick out certain themes, ideas, and then they can just come up with their own. So again, it takes that, that motivation to do that. So let's go with first. I see Lakshmanan's hand. Oh no, not Lakshmanan. I see Jyoti's hand. Go ahead.
Karthik, I'm just going to answer the different question that you asked earlier, like how the entry level graduates are getting their confidence coming out after graduation. Okay, so us seeing and working in seeing in the developed countries, what I feel, and also I'm putting my own experience into practice. So when we are during the graduation and during the clinical placements and also during internship, we have been only exposed to clinical conditions. But however, the evaluation, I don't think there is a well-structured evaluation and to focus on how confident it can make a student clinician into an entry-level clinician. Okay, but in countries like in rest of the world, I think as Ashwini mentioned, a role of a practice educator is well developed, and the assessment tool is developed. How a student clinician can transition to an entry level clinician, and also how grading they can go with. So usually, like the grading here are from observation and then under supervision and then as an experience or even like you get that experience, so that is the grading level. And like few of my colleagues here might had an opportunity to take a students from universities, and this is how we train them to achieve each level, and then we determine whether they are passing that clinical placement or not. So if I'm not sure because it's more than 20 years since I graduated from India. Like probably there might be an academia who might have joined in this meeting, like Lakshmanan or even like Murali, and you can explain more like whether how is the standard of those placements in Indian colleges or there at the moment. And maybe this we can't put that responsibility on a student who is only like going to learn the curriculum, but it has to goes to the people who are being responsible for the clinical governance or even the curriculum governance, and there is a role for them to make sure how these clinicians are coming out with more focus on, because that's before we take a vote on a graduation day, all these foundations should be laid out strongly, and it's not only the students. Okay, that's my perspective. If I can add on that. Okay, thank you.
You highlighted some great things. Let's hear from Murali, and then I'll add to it.
Jyoti, thank you so much. What you mentioned as in a very subtle way, but that's exactly the scenario, and that is what the direction we should also be focusing. All the academicians should be focusing, or even the clinical people who are guiding the students should be focusing, because the future is in their hands. We are all in the beginning of phase, and then they are the future for us. And I would also say, there is this interesting development in our field where the people who are selecting OT nowadays, because when I was selecting, I was like, I had my civil engineering waiting, I had my physics waiting, and then I just took it up because I was given a free seat, and I liked the entrance to the UG college. It was like more mentally it was pleasing, so I took that chance. Then I found out what the OT is, and then we go. But now people who are coming out have a better understanding of what OT is, where are the scopes and opportunities, and where all they can go. That definitely they know. The skill level in that they need to more get trained and then understand it better. But I would say they know it. Recently, what happens is more of the students, more of the occupational therapists, or more of the medical practitioners, their children are doing occupational therapy, knowing what their parents have gone through, what their siblings have gone through in the treatment. So people are understanding and coming in. I have few people who are adult neuro clients. Their children have taken up OT after seeing their parents taking treatment in OT. This is really something new, and first year, second year students really trying to understand what OT is now itself. They come to clinic and ask questions. Before admission, we get a lot of people coming into clinics. I don't know if they are going to colleges and asking this, but they are coming into clinics and asking, sir, what is your practice? How do you do? What is the future? So we want to see how you work. All this, that's what the generation is like, slightly in a better position than where we were in that way. So they are proactive, they are trying to explore and figure out what it is. To some extent, they are well equipped in gaining that knowledge and understanding that also.
You brought up an excellent point. I'm so glad to hear that, the students are doing some sort of a shadowing to understand where they, what they're entering into. And I mean, that is sort of a very common practice in several of the Western countries, in fact, it's one of the admissions requirement that they have some sort of shadowing, and they need to document that when they apply for the, apply for the seat. So that I'm glad to hear that that's happening now. And also, like, again, tagging along with that comment, I'm kind of looking back at like 2 or 3 decades ago, we didn't have this many settings for us to do these type of shadowing, number one. And number two, again, in terms of exposure, like, you just mentioned a while ago that you only had that certain case. So you had that opportunity to work with the client, so that kind of boosted your confidence. But how many of the other students got that same level of exposure and hands-on practice element when they did their entry-level degree? So one thing that I could really like see that is, things have changed a lot compared to when we were all students. That's one thing. And second thing is, with technology, with increase in the number of practice settings, and also, in general, the societal development leads to more, assertiveness, more confidence. All these are kind of playing out favorably. And also, the students are like, they have more opportunity. But one bottom line, the one bottom thread in this entire discussion that I could see is, a lot of us develop the competence and skills with practice. When we apply that learning in a real life context is when we are actually growing ourselves. So again, we have this NCAHP, all these modern development. There is a big broad curriculum that was recently published, we all reviewed. I think we need to drill more on the competence side of things. Is basically, I'm not like telling the first 4 years is going to be pretty much didactic with some clinical component involved in it. But earlier, the students got exposed to hands-on practice, through some sort of, level one type of internships during the didactic portion. And then during the 6 months internship, that's when we are grooming that student to become an entry-level practitioners. So yes, we are doing it. It's there. It's been there in place for a long time, since BOT came into picture. We had this internship thing. But probably we need to come up with a little bit more valid outcome measure where we kind of check off on all the areas, like, um, professional behavior, their skills to do complete an assessment, their clinical reasoning ability, planning an intervention, implementing an intervention. Also, like, looking at applying evidence into practice, awareness of ethical and organizational aspects related to practice. I think we are really doing good in certain parts and certain pockets, but maybe we need to go from a more of a competency level framework. We need to constantly survey the entry level practice to see what does an entry level practitioner need to know, right? And then maybe we can use the data to come up with some standards and guidelines, and then say, these are the competencies that should be demonstrated by an entry level graduate in India to meet the demands of practice, and that should inform the curriculum, that should inform the fieldwork outcome measures. Like, I use the term fieldwork here, but internship outcome, right? So we need to have them sort of a valid outcome measures, because based on what I know, again, I'm out of the Indian context of practice for many, many years, but what I feel is that, of course, depending on the setting, you might be asked to do a case study, right? Depending on the instructor you have, they might be a little bit more vested and demand you to do certain things. Just other places, as long as you're there, or even you're not there, or you just simply like, what are the cases you were given, whether you do it with good clinical reasoning, or you're simply doing something to occupy the time, they don't care, right? So maybe at the institutional level, if we have a little bit more standards, a valid outcome measure, that maybe I would even say like developed at a national level or state level to meet to suit the needs. Those kind of like, the governance level aspects need to be in place. And I think that's the direction that we should move forward. There are definitely some positive developments with all these technology and other things. I'm glad to hear, especially the fact that the students are now trying to inform themselves before they chose this career. That wasn't the case definitely few decades ago, or at least a couple of decades ago, when we were all entering the field. Jyoti.
Karthik, I agree with everything that you have said, but as a Indian trained OT, I would like to focus something else that the young generation coming out of OT colleges should also focus on. Apart from, I know, like the Indian curriculum is really good and thorough, and which that's why, like the curriculum is widely accepted by any developed countries. But what challenges, even though they are going through this length of curriculum and theoretical and practical aspects, and how, that is a barrier for now graduates not able to reach the international healthcare market. Like okay, when you look into the interview, it is going to be how you sell yourself. Okay, I'm currently mentoring a few people, like from India, who wanted to get opportunities and get into get a successful at the interviews. But what I learned from that is, though they have the theoretical and practical knowledge, they're not able to achieve the skills of how to face a um, competitive interview or a structured interview. So that is something that, yes, as a part of curriculum, they need to attain that. And competency-based interview are all like live examples and not speaking on theories or stories. And that is something that it should be part of the curriculum, or even like they should during the internship, at least the educational sector should train them how to. If not, like they wouldn't be able to face those competitions in those interviews, because here interviews are straightforward. If you get the panel, get the ranking, you are there. If not, like you will be down the ranking. Okay, similar to what I can see is in Crystal Medical College. Yes, they had a structure, panel system, ranking system, and students graduating should know the commitment, and it's an another add-on skills that even the academia in India should focus on.
Thank you. Thank you for sharing that view. I mean, I agree with you, like communication skills and other things also like need to be evaluated. I think an objective competency-based outcome measure would really address a lot of these things that we are talking about, and then like address those missing areas that we are deliberating now. Again, we are at almost at the top of the hour, but I just really want to take maybe a couple of minutes. Each of you take 1 minute and then like say, how can senior OTs support newcomers or new therapists in India? So just like one minute each. So Lakshmanan, I would like you to get started. Just strategies, like be specific, like bullet points.
Yeah, it is going to be just straight away the three areas to be strengthened. One is, as I said earlier, clinical skills, mainly clinical reasoning may be part of it. They need to be mentored. That is one. Two, the documentation and research skills. These are the two areas which has to be kind of, as you said, it is more of, it comes with the practice as this thing. But even then, they need some support. They directly landing in a place where there is no support from OT is going to, whatever they do becomes the right kind of a thing. So it needs some kind of a mentoring from some experienced person. That's
got it. Murali.
I was actually about to ask you to let me in a little quicker. So, see, I would also say that it has to be a collaboration, because looking at the future for us, we should put aside our differences, both the practitioners and the academicians. We should work together, because the academicians should be inviting more clinicians to give the more clinical side of knowledge to the students, and their experiences would come in handy when they are doing internships. More way, the clinicians or the private the practitioners should also reach out to the colleges, maybe the alumni. In that way, I would say the Lakshman's college is doing a fantastic job in that matter, where they are bringing in the alumni and giving that more exposure to the students. That's one aspect. where the real life scenario is different from the college campus and to the clinical campus, even to an extent of talking to the colleagues is also a different, literally a different zone when it comes to this. So this combination of both people coming together will be the right thing. As individuals, I would say, whoever comes to you, training them and giving them the basic understanding of how the cases are being handled, how treating a client is not good enough. As an occupational therapist, we treat the whole family and the whole community into the picture. That has to come into the front for the people, because that, I think that one part is missing in the academic front when it comes to holistically handling it. Theoretically, it is there, but practically how it is being done is definitely missing from my point of view. So that's the whole point I would like to say. But again, this is totally a different picture in different parts of India. When I said I was coming out of UG, I did zero practical experience. But when I went to Bombay, I see a first year student entering inside an NICU or a cardiac unit with a stethoscope and going and doing it. So it's a vast different experiences in different places. So we need to think about that. I was actually expressing my opinions only from my zonal perspective, but I think the other parts of India were having a different exposure. So that we need to think about also.
Got it. Got it. Thank you. Mr. Godandan, sir.
Thanks, Karthik. Yeah, so in my view, what I'm really mentioned there, when I graduated, there's a less opportunities and choices even getting into the college. Now the choices and the opportunity even getting into the college, so they choose the OT. At the time, it was less choices, and now, so that's the point. So as a India, it has actually improved a lot. There's a loads of choices and opportunities, and people choose the OT now when they come in. And what I'm trying to say, the OT isn't what I can see, the OT field in India, even though it has actually improved as so much, it hasn't actually improved as level with pair with the other fields. And that's why we see even before they come to the OT practice, join in the college, and people have experience from different fields. As they come into the OT, is not a kind of equipped to meet their expectations. So as some of you mentioned, there's the competency, as Jyoti mentioned there, the competency it's kind of a target they need to achieve. The most people want to develop and they want to match the competency. Once they are given what to achieve, they'll achieve. And that's my opinion for the India. And in terms of the general kind of OT practice, so once you're in the academic, you have all the theoretical and hands-on kind of, you can sell better because you're in the practice of speaking and speech. When you went to the kind of clinical practice, it's more hands-on. So you need to take care of yourself to sell and articulate what you do and what you think, because most times there could be a mismatch between what you expect and what other expects you. So that's when the mentoring and guidance comes in. The students in the colleges, they could do with that bit of guidance that's coming back to the competency. So if there is set up or a kind of a thing they can expect to, and given the direction what to learn, and the same thing, the mentoring can guide them through the opportunities. That's my opinion.
Thank you. I think I could see the term. Ashwini, if you have anything to add other than what has been shared in terms of how senior OTs can help entry level OTs in India.
A lot has been said, and I resonate with all of them. But I think the role that a senior clinician can have on an entry level clinician is actually, it's huge, and I think it's being undertapped or not being tapped at all in India. Mentorship is needed across our career, no matter how senior a person is, and as academics, as teachers in placements, people need to set examples themselves, or as somebody who is seeking supervision throughout their professional career. And I think we need to have a lot of that. People need to set examples to see growth in students and entry-level clinicians. I think mentorship is, for me, huge. That's one huge point. So I'm going to leave it at that.
Got it. Thank you. Jyoti, anything you want to add in addition to what has already been said in terms of how senior OTs can, help or support newcomers?
Yeah, I will suggest on clinical supervision, and doesn't it has to be like kind of a continuous professional development. It's a part of it. The seniors should engage in a structured clinical supervision so that like they focus on the clinical aspect, and then how they can promote further learning. And it should be a standing agenda, like whoever the juniors are, and it's a commitment on both sides. I wouldn't say like it's a commitment on one direction. It's a commitment on a mutual direction, and it's to benefit the goals of the department. And also peer support. So even the juniors, sometimes they feel that not to go to the senior, so they should also engage in peer support, and that's a point I can mention.
Sure. Thank you. Thank you. There's been an excellent discussion. Just to wrap this all up, it looks like definitely there has been some advancements in the way that entry-level practitioners are coming out of the institution nowadays compared to what was, in the past. So that is a good sign. But there are certain areas that we should, like, I think that a little bit more standardization is what needed. And also we need to again come up with some sort of a valid outcome measures where we kind of like check off all the boxes in terms of the entry level skill set when they before they graduate out of the institution. And as has been already said, I think mentorship is crucial. Providing opportunities even before they entering the college, like providing them with shadow opportunities, or once they are in doing supervision, or soon after they come out of it. Providing mentorship is a great way to support the newcomers in India. I think it's all beautiful points, but I do want to highlight the point that Jyoti just mentioned, that it has to be both sides. So even the entry-level practitioners and the students who are doing their internship should try to reach out, to their senior therapist, and come up with a mentoring plan, have some sort of a mentoring goals. And maybe if that process is a little bit more structured, it's going to, I think the self-driven people are doing it in some way, and they're going to do it. But if we standardize all these things in a little bit more better fashion, I think it will going to help a wider population. Excellent discussion. We had generated some wonderful themes here. I hope people listen to this recording and then try to build upon. Please share widely. Once this recording is posted, I will also email all the registrants. But please feel to share this, spread the word. And I just want to also mention that IOTT membership is open now. Any interested member who's passionate about the field are welcome to join us and support advancing the field. We always welcome ideas. If you're a member or not a member, but if you have some great ideas to advance the profession in India, please write to us. Thank you so much for sparing your wonderful time and providing these insights and make this discussion very rich. Wherever you are, enjoy the rest of your day. Bye-bye. Thank you.
Thank you. Thank you, Karthik.
Bye-bye.
Thanks, Karthik.
You're welcome. Bye-bye. Bye, everyone. Good day.
Thank you.